Okay, thank you everyone for coming to today's CITP lunchtime seminar. Today I'm very pleased and honored to introduce Professor Ellen Zegura from Georgia Tech. Among many other auspicious appointments, including being my former boss as department chair at Georgia Tech, she's done a lot of really interesting work, both as a computer networking researcher for many, many years, doing work, some of the fundamental work on the internet's topology modeling, way back. But more recently, she's...
Thank you, Nick.
Seminal.
Even 3 ways back. One way per
work,
decade.
More recently, she's been doing a lot of work on the intersection between computer science and computing and societal problems. While I was at Georgia Tech, she started a class called Computing for Good, which I think she'll probably talk about today, and it seems like it's grown in many different directions, including data science for social good. I should also mention, she's probably not going to talk about it today, but another topic that's of interest to this group is she's done a lot of work on ICT for development. In particular, she's done a lot of work in Liberia, in tech for development there, including election monitoring, which is a topic that many people are interested in here. So,
yeah.
Great.
Thank you, Nick.
Thank you.
I'm pleased to be here. I'm pretty sure that this is the first time I've ever given a talk at Princeton, which is a little bit surprising. So it's, I guess, about time. I'm actually going to talk a little bit about Liberia. This is not going to be a deeply technical talk. So some of you are like thinking, yes, that's great. Some of you are thinking, oh, that's too bad. But those of you who think it's great will be happy. And some of the work that I'm going to talk about is relatively new work I've been doing with Carl DeSalvo, who is in digital media at Georgia Tech, and Amanda Meng, who is a research scientist postdoc working with us, plus some community partners. So, when I was working on the talk, I looked at the kind of speakers that you had relatively recently, and so I see that there's been quite a kind of AI and social good sort of theme for some of the talks, and so I wanted to kind of tie into that. So to start with, in terms of this doing work in computing and this term good, as Nick alluded to, I go way back in this area. So out of 105,000 results, apparently, the second one, I don't know what these people are doing, but the second one is a blog site that we created back in the 2008-2009 time period, which is when we first started offering this project-based course that we called Computing for Good. And it was undergraduates and master students working in teams on projects, and the projects came from external partners. That's actually a kind of key theme for some of the things that I'm going to say, is this presence of external partners. And so I wanted to just give you a flavor for what some of that work was like. This is the Liberia work. It's not in the election monitoring, although if you want to talk about election monitoring, later, I can say some things about that. So this was a project. C4G is was the shorthand we used for Computing for Good. And this was a project with the Carter Center, which is fortuitously based in Atlanta, and many of you will know this is the effort that Jimmy and Rosalind Carter created after his presidency, and I would say it's actually been a much more extensive and impressive impact on the world, actually, than his presidency. For a variety of reasons, one of which is just longevity. In fact, the Carter Center's been around for a long time. So they had been working in Liberia. Liberia is a West Africa country that was formed as a return location for freed slaves. That's why it has the name Liberia, kind of liberty. And that was done by taking land from indigenous people, so never a good idea. And the Carter Center had been working there on peace projects and access to justice kinds of projects. And they had noticed this tremendous unmet need for mental health care. Liberia went through about a 20-year off-and-on civil war, and related to the fact that land was taken from indigenous people in order to settle. So, the Civil War was not, there was no front line. It was sort of everywhere, and so there was no way to be not impacted. You couldn't just sort of stay away from the front line and then you could pretend that there wasn't a war going on. Like, everyone was affected. So they noticed from their work there that mental health was really not getting, that there was a huge need, unmet need, and that was generally true in the global South. So I think to some extent we think that, if you don't have vaccinations or you're dying from malaria, that's more pressing than mental health. And so a lot of the dollars that are going broadly under health go for programs that are not mental health programs. So the Carter Center wanted to essentially pioneer developing mental health capacity in a country where there really was essentially none. In fact, when the Carter Center started their project, started in Liberia, there was one psychiatrist in the entire country. Now, it's not a huge country, but one is a really small number. And further, that guy was actually in private practice. He had gotten tired of being the go-to guy for everything, and so he was in private practice. And there are 3 psychiatric nurses. So, and this is just an example of what the pharmacy looked like. They were clinics that would operate, say, for a half a day in a location, and then the next afternoon they would go to a different location. And so this was the sort of portable clinic. They had tremendous portable pharmacy. They had tremendous challenges getting drugs into the country. So it was just a lot of challenge. And so this is this is a patient records from a visit to a hospital in Santa Quele, which is in the north east of the country. This picture was taken in 2011. So, we're not talking about that long ago. And, this is what a patient visit reminder would look like. So obviously a piece of paper that's been used for other purposes. It has a name, it has a number on it, and G.W. Hartley Hospital and a date. And there, these numbers, which are getting crossed out, match up with these numbers. So as you use a new number, you cross it out, and that's how you keep track of numbers. So really a tremendous amount of need. And the Carter Center is a super smart organization. They really know how to work well with a host country. So first of all, they will not go into a country without being invited. So that's the sort of starting point. And from day one, they are planning for their departure. They're planning to turn for the sustainability of the project and for local people and local capacity to be able to take the effort forward. So they're very, very smart about that. And in this project, they realized that training psychiatrists was just a non-starter. Okay? First of all, to become a psychiatrist takes a crazy amount of time to become a psychiatrist. Like, first you have to go to med school, then you have to do a residency, and then you have to do a specialty. And I mean, it's like best case, it's about a 8 to 10 year time period. And there was really no educational opportunities that would have made that possible. So what they did was they said, let's take people who have had basic training already, practicing nurses, physician's assistants, midwives. They know something about the medical treatment, medical diagnosis, and put them in a 6-month intensive mental health training program. So that way, twice a year, they're turning out a cohort of clinicians who would return to their original practice location, but add mental health capabilities to their portfolio of expertise. So they wanted to know whether the program was making a difference in an outcome measure, the outcome measure being patient improvement. Now, this is super challenging, right? So first off, this is the state of some portion of the medical record keeping in the country at the time. And now you're training clinicians, they will see patients, and they wanted to know whether these patients get better over time. So that's a super big challenge in this kind of an environment. So we got together with them and with students over a couple different instances of this Computing for Good class, we built this software that the idea was the clinicians use the software when they see a patient. They use the software to enter without revealing patient name and identity, demographics about the patient, results of various diagnostic testing, a diagnosis, and then some information about what kind of treatment was done. And then they wanted to be able to, of course, link these records one to the next so that you could watch these function measures and see if they changed over time. So we built this software. I went twice a year for 4 years, so 8 times, to Liberia to train each new cohort in how to use the software. Actually, I also had to train them in how to use the laptop. So most of them had almost no laptop experience. So I helped the Carter Center figure out what to buy. At that time, these $500 netbooks were the right answer. And so it also professionalized the work that the clinicians were doing, even, not just the software, but the idea that they could create and use, say, PowerPoint presentations and documents, just a level of professionalism that, of course, we take for granted here, but was really not, those tools were not in use widely in the country. So we did this project. It actually turned out to be a big deal for the clinicians, by which I mean hard, for the clinicians to actually successfully complete this workflow. So every step along the way here was a challenge, including there was a huge stigma around mental illness and lack of understanding, not unlike in the U.S. And so even to be referred a mental health patient was not an automatic. And they were going back to clinic settings where they had been practicing before, and so they had a practice of non-mental health, and they were supposed to begin seeing mental health patients. So every step here, if you've ever spent time in a country, with low GDP, the laptop had to be powered. That was not obvious. The power grid infrastructure was completely destroyed in the Civil War. There were a lot of generators in use. They had to use our software correctly, and then they uploaded the forms to the cloud when they had connectivity. So forms would be stored locally. When they had connectivity, they would successfully upload. So this was, and the laptops. Somebody who would know once told me that every thumb drive in the entire country had a virus. And that's actually a really hard problem to solve. At one point I was like, how can we solve it? I think I mentioned this problem to you when I came back. I was like, what could you do about that? The laptop, there are just all kinds of issues. So this was really challenging. And so we were quite interested in what was it that led clinicians to actually complete this process. And I'm going to transition out of this project in just a minute, but I'm just going to tell you that. We did a study on what were the motivating factors that caused people to really want to participate. And we drew on this literature on pride and perseverance. It's really fascinating about when people are willing to keep trying to do something and this connection to pride. And we absolutely saw that. Actually, we didn't have that as a starting point. This came after we saw the data. We said, okay, this is really so they wanting to be able to show people that Liberia was about something more than civil war. That was a big deal. Wanting to be able to show that they had a practice, a mental health practice, that they had been trained and that they had learned what they were supposed to learn and that they were actually doing the job. That was important. They knew that the Carter Center was a really big deal, and so sort of the pride of being attached to that, but also wanting to show, because the Carter Center was a big deal, about what they had done. All of that was a really fundamental part of the work. So this paper appeared in ICTD 2015, Singapore, 2015, yes. And it was really the culmination. Okay, so it was the culmination of 4 years of work. When we started, I was not thinking I'm going to write a research paper about this. It was okay. We're going to have this class project. We're going to work on this. it ended up that we did multiple iterations of the software. As I said, I went 8 times. The last time was Ebola summer. I was there in July before it was clear that it was going to be a terrible outbreak of Ebola. At the time, it was like, okay, maybe it's under control and it's just going to have a form not unlike other outbreaks where it's bad, but it's relatively local in time and in geography. So then it completely blew up within a couple months after I was there. The sustainability of the project relied on something that actually is not good. And this is another sort of theme I want to tease out here. One is this long-term relationship, and another one is sustainability. So this student was a master's student in the fall offering of the class. And in the spring, like all good master's students, he wanted to do a project for credit. So he worked with me, and he really developed the software version that ended up getting most use. He went to Google, and he kept answering my emails about, looks like the server might be down, can you restart it? Looks like, can we add this functionality? So he kept doing it, which was very cool, but also very problematic from a software maintenance and sustainability standpoint. So that's another, and this project was probably, I mean, there were some other folks. Santosh Vampala, who's a theoretician, was a key partner in the C4G class, and he had some projects that also made it to deployment and had some significant impact. He had a good partnership with the CDC, also based in Atlanta. This was probably the most successful project that I had, and it was successful in some ways, and it was more successful in some ways and less successful in others. And the sustainability thing was quite a big deal. They have talked to me about wanting to port it to smartphones, which are now available and used. And I told them, I mean, that it's just a bad idea. If they wanted something on smartphones, they should start from scratch. And this has been held together with chewing gum and baling wire, and you don't want to take that and try to stick it on a smartphone. So over this time period of working on this Computing for Good class, so one thing that happened pretty early on is we got a ton of criticism for the name, for using the name Computing for Good. Jean's giving me a puzzled look, which is actually totally consistent with the conversations I've had with non-technical people, which is that they think that name is more or less completely fine. Maybe even some technical people think that name is more or less completely fine. But I can tell you that there are a set of people who think that name is terrible. Okay, so do you know why?
Because all computing's for good.
Well, I think there was a bit of that. That's one part. Actually, yeah.
Well, I would question what you mean by good, because
Yeah.
it means a million things to a million different people
Yes.
in all different contexts.
Yes.
So if you define one good, you're promoting one person's interest in
Yeah.
a particular place.
Yes.
Which could be also, profit can be good, for example.
Right.
Or privacy is good. So it doesn't mean much, I think.
Uh-huh. Nick, do you remember these discussions? Or you're
No, I
just
was
gonna
thinking more,
make a guess?
Does it have some sort of colonialist kind of
Yeah,
feel?
I think there is.
Yeah.
Yes, I think there is some, and in that regard, the word "for" was problematic. So I used to be like a networking person. I didn't worry about words like "for." I might worry about the number 4, but I never worried about the word "for." But I've been educated. So then we started doing things like change the for to and. That seemed a little better. Change the good to social good. I don't think that really solves the problem that you are raising, which was definitely an issue. There were also Computing for Evil T-shirts that sprung up spontaneously. And then, okay, so we played around a bit with terms. Unfortunately, we had gotten so used to saying C4G, and it just rolled off the tongue. That was an extremely hard habit to break. So then the science for social good efforts came along, and Chicago funded by Eric and Wendy Schmidt Foundation, funded very generously a summer data science for social good internship program. And we looked at that and we're like, we've been doing this for, this is exactly what we've been doing. We weren't restricted to data science, we were broader than that, but essentially that had the model of projects, students working in teams on projects that came externally was very familiar. It was the same model that we had used. So we decided to run our own DSSG summer program, and Chicago did it one year, and then we also did it the next year. We had a program, and they did it as well, and now there's some more sites. So, Nick, you asked about this. This summer will be the 5th offering of the internship program. We didn't have Eric and Wendy Schmidt giving us a lot of money, so we decided to turn it into an NSF REU, Research Experience for Undergraduate site. And we decided to change the name, in fact, to Civic Data Science. So this sort of names the domain. It's still civics is a pretty big domain, but it names the domain in a way that's more specific than just saying good, and also isn't a value statement. So that name, I think, is a pretty reasonable one. And then, I don't want to belabor this because I actually have a whole second part to talk about. I've now gotten heavily involved, and Marshni and Nick are both also part of this, in creating a new publishing venue, which is a conference called Compass, Computing in Sustainable Societies. And here we spent a lot of time on the name and on variations of social good and not social good. And I'm pretty happy with this final decision of sustainable societies. We wanted to bring computational sustainability people into the fold. It was very important to them that the name contain something sustainable or sustainability. It also dovetails with the UN's Sustainable Development Goals language, which I think is a strength. This will happen in June of this year out in the Bay Area. So lots of evolution in names, and a caution, I think, about the word good, and that social good, while it's perhaps a bit of an improvement, it really doesn't get away from the most fundamental problems with that word. And then I would not use for if you're choosing names. Don't use for. Just use and. That's my. So now. Okay. So this is 10 years of the class. All those 10 years of the class offered once a year. A bunch of summers. But now I want to talk about thinking about this all in actually somewhat of a different way. And I don't know if it's really a revolution, but it sounded good. Which is, that it's not just about the problem selection. Okay? It's not just about picking what problem you work on. It's actually about an entire process and an entire practice going back to picking a problem and all the way through to what happens downstream with the work that you have done. And it's not a simple, clean, you give me the problem, or I listen to you and I abstract the problem, and then I go over here and I work on it, and then I write the paper, and that's the end of it. Okay, it's much, much messier than that. And with Amanda and Carl, we've been this is quite new, looking at the concept of care as a way to carry kind of the intent that's captured by good into process and practice. Has anybody read any papers on technology and care? No. Okay, so it's it's totally new content. You have?
Yeah, there have been some, recent ACM papers about, ethics of care and technology coming out of, Jeff and Xiaowen's group. Some PhD students have been reading their work on this topic.
Cool. Great. So there is a nice line of work that started, but it's relatively new to see it, in the HCI kind of literature, which is, I think, the best sub-discipline of computing where it fits. Laura Cornell. So Steve Jackson and Lauren, whose last name I'm not remembering. They've done some work on care and repair, the kind of caring for the mobile phones in the developing world. So this comes from the longer term research thread about care in practice and care in practices that include technology. Actually comes from Science and Technology Studies, STS. And so scholars in that field have looked at a number of different domains in which care takes place, and there's technology. And so one of the points they're trying to make is it's very easy to think of care and technology as being so completely different from one another. Care being warm and personal and human, and technology being like cold and impersonal and rigid. And they're really trying to make a case that that's not true, actually, that there's an opportunity. One way to think about care is adapting of technology to purpose and adapting of purpose to fit technology. So this kind of give and take of what you're trying to do and what you have available as tools and what the tools can do, but then what you want to do. How do you make the tools do what you want to do? So this is something we've been exploring, and we've been doing it by thinking about and working with community partners on essentially a data science process. These are the usual steps you see in data science: problem formulation, research design. Maybe more emphasized tends to be this half, but gathering and wrangling data, analysis, to your point about your work that you're doing, the pro bono analysis work, visualization and use, and there's lots of back and forth between these. This doesn't always happen in a very linear way. But when we talk to community members about what they want to do with data, they talk about things like, they're trying to make social change happen, or they're trying to reveal what they believe is truth about, for example, their own built environment, their community's built environment. They want to be able to do things like contest official versions of data. So, the city goes out and through some surveying process says, the plots on this street, this percentage are vacant, this percentage are owner occupied, this percentage are, dilapidated. And they want to be able to contest that. They don't, they know locally what's happening, and when they see errors in the city's data sets, they want to have the authority to be able to disagree with what is happening officially. So they talk about these kinds of things. They want to be perceived as experts and able to take sort of expert acts, not like, the way that, so not to be dismissed. That is to take their knowledge and their understanding and their concern and care for their community, to have that fit in as experts within the context that data is being collected and represented, and decisions are being made on it. Okay, so that is the sort of bottom line piece, is that data that's collected about communities gets used to make public policy decisions, or to to allocate funds, public funds. So in the case of these communities we've worked with in Atlanta, there's the Mercedes-Benz Stadium, the new Atlanta Falcons Stadium, went up in the area, and there's a Beltline rails to trails project. So there's a lot of concern in the area about gentrification, about the driving up of property values and the resulting property taxes. So people, even if they own their own home, property tax goes up. Suddenly you have to pay a lot of money to live in the same house that you've been living in for 40 years. So the Falcons football team, just making sure, created a fund to help offset property value tax increases. But there was a lot of question about the assumptions behind how much money was in the fund. Was it going to run out? I mean, they were promising this will last for 20 years or whatever it was, about whether they really knew what they were doing in terms of deciding how much money should be in the fund. And so understanding things like how many owner occupants there are is incredibly important, because renters obviously are not don't benefit from property tax controls. So the sort of big idea that we're exploring is how do we do this green part? How do we try to help create tools? So we are technology, well, actually, Carl and I'm the most I was going to say we're technology people. We're actually not completely technology people. We're like technology people and other stuff. But one of the things we do, want to explore is what's the role here in tools to help bridge between these kind of community goals and this kind of data science process to make it, careful.
So the people you're working with, though, have some understanding of data and they work with data. I mean, if they're realizing that the data is biased or they're following
So
data.
They are surprisingly, so I think they would surprise you in both directions, both their sophistication and their lack of sophistication. So they're generally high school educated. They are living in one of the highest poverty parts of Atlanta and one of the highest crime parts of Atlanta. So I'll tell you a few stories about the things that we've done with them that help reveal both their capacity for understanding data and, some of the limitations because they, are not educated in data. So this is this Mole is the author with two other folks of an edited volume on care and practice. It's really excellent. So if you're interested in this, I highly recommend getting this volume. And the very first chapter that lays out the rest is just incredibly beautifully written. And this kind of persistent tinkering, so this is where the tinkering came from in the title of the talk, persistent tinkering in a world of complex ambivalence and shifting tensions. I highlighted this kind of interpretation, this adapting of tools to purpose, and some other things that I think we don't yet have exactly the right way to quickly tell an audience, especially technology audience, what care means, but this gives you the gestalt of it. So what we have done now is with community partners walked through these stages of the data science process, and looked at the tools and methods that we can use to help bring care to that, and also observing what they do with respect to care in the part of the work that they're doing. So in problem formulation, we've been using something called a theory of change, where you establish an end goal, a long-term goal. And here it's organize the community's power for self-determination, to serve and preserve in-place residents, and a few other things, by way of a community land trust. So you establish that's the community's long-term goal. You have preconditions, what would be necessary for that goal to be achieved. And then you work backwards from the preconditions. Typically, each precondition produces its own pathway to change. So you work backwards like this, and then you pick one of these pathways to follow, and over a long period of time. This is not a semester project, right? It's not a 3-week project that high school students are going to do. So this is the way that we do problem formulation with our partners. In research design, this is another one of our partners with a class that Carl was teaching, looking at how to design data collection. This project has to do with looking for code violations in the neighborhood. So the city has people who go out and look for code violations, but they aren't that many of them, and they aren't allowed to walk onto properties, and so they're kind of limited in what they can do. So this is a conversation about what kind of data collection would make sense in that setting. This is a data gathering effort that has to do with collecting video to tell stories about what it would mean to have property taxes go up. So these are residents in the neighborhood telling stories about the lives that they are leading. This is, her dad bought this house when he got out of the Navy in the 1930s, and also asking them about what affordability means for their own local circumstances. So the community wants these videos to use to tell stories with data and stories about data. So storytelling with data is huge for people for whom the data actually matters. And so this is a project to gather these together into a portfolio for the community to have of data connected storytelling and visualizations and other kind of data products. This is Mr. Canty, who was in the research design slide, talking with some students and doing some. They're actually documenting, but you can't tell because she's hiding it. And then analysis, and this is a place where some of the sophistication shows up. So this woman is actually part of the drug dealer family, a key drug dealer family in the West Side. She's not involved in drug dealing anymore, but she knows everybody in the neighborhood. She knows the neighborhood very, very well. And she took part in this project to go property to property, categorizing them as vacant, occupied, dilapidated, there's a whole set of codes. And so on a tablet that we had set up, she walked the neighborhood with our research scientists, doing data collection of this built environment. And then she's sitting down and she's actually going through the data and looking at Google Maps and trying to make sure that's correct and moving things around so that they're well lined up and accurate. And the commitment here to accuracy and to drawing on other tools to help triangulate what the result is really phenomenal. And she really cares that this data is right in a way that no one step removed data scientist is frankly ever going to care at that level that this data is right. Nick?
Your abstract alluded to ethics. I'm thinking about like her safety. Is it safe for her to participate? Like, does her neighborhood wanted know that she's doing this?
Oh no, so she can do this work in a way that we never could. So she's respected so she's highly respected in the neighborhood, and everyone knows her and respects her in part because of what her history has been. She's not adversarial. So I wasn't there when this happened, but after she got this whole thing lined up, she was like high-fiving our research scientists, like this is correct, and we have the only correct version of this data, which is undoubtedly actually true. So this is kind of amazing, actually. Both how little someone like this would have previously known about data tools, but also how committed she was to understanding it. And then we did some matching up to property tax data, and we had a student do that because it was very tedious, and that's why we have students do it. It's very tedious and time-consuming, and so she was fine with that, but she wanted the student to walk her through what it was. So she did not want to just be like, okay, you did that part, I trust it, let's keep going. She said, show me how you access the property tax database online and how you bring this up and how you take that result and you put it into and she also would refer to these properties as my properties. Oh, my property should be this way, or my property. So this, that's another thing. A data scientist, we're never gonna feel that ownership and pride in that area as someone for whom it's just huge stakes in doing it. This is some examples of some visualizations. This northwest street, which is quite important in Atlanta's history, including Martin Luther King's childhood home, is either on the street or near the street. They had done a survey in 2014, and this was to update to 2017, looking at things like changes in appraised value. And on the right-hand side is this built environment codes, as I was mentioning. These kind of, is it dilapidated? Is it in good condition? And as you can see here, the green are the color codes for vacant. And there aren't too many abandoned. That's black, but there's a lot of vacant lots, a lot of vacant properties in the data set. And then downstream uses. So this is an example where a church group, a Presbyterian church group, decided that they wanted to understand more about gentrification. And so they organized having people come in and talk about gentrification, including the guy who runs the Falcons, this West Side Future Fund. He came in and talked. They invited the community to come. So here they're using data sets and presenting data sets that they have collected in order to talk to interested citizens about what this kind of gentrification means to them. So, it doesn't stop with, we might frequently stop here, right? Like, okay, for the visualizations, now we can write the paper. But it's the downstream uses that, this is the, this is not the goal, but this is a step along the goal to try to make many people who have voting power, for example, aware of what the situation is right there on the ground. So this is the data use part that really starts to push on the long-term goal. And in this case, what they would like is to create a community land trust. In a community land trust, the land trust owns the land, and you own the house on the land. And when property taxes go up, it's the land is the property tax that's taxed. The house does not. The house, you own the house. So it's a way to buffer housing owners from increases in property taxes because those are borne by the land trust, and frequently land trusts can make deals with government to reduce the amount of inflation because they can operate as a much bigger block, right? If they have a lot of land. So that's where these folks are trying to head. So these are the kind of research questions we're asking. What's a community engaged data science process that's attentive to care? We see all kinds of demonstrations of care when we work with community members. We're also have a sense that in terms of developing data literacy in communities, that having people working on things that are about their own community that they have a serious stake in could be a much more effective way to develop data literacy competencies than something that's very abstract. So there was a really well-known educator who took a group of minors who were illiterate and attempted to teach them literacy using concepts that they were encountering all the time, as opposed to a very generic curriculum of literacy, and saw these. This is Pablo Ferrari. Saw incredible differences in the rate of literacy learning when the context was relevant and immediate as compared to generic. And we think that there may be something similar, a similar power to care and local conditions and data literacy, and then this tools part. So there's some questions that I thought might be good ones for some discussion, but also I'm happy to take questions. So thank you.